Welcome to Mental Health in a Safety-Conscious Workplace. Our academic partner for this webinar is the CN Centre for Occupational Health and Safety from St. Mary's University in Halifax, Canada. Thank you for joining us today. My name is Yusra Benjeloun, Administrative Coordinator and Projects Manager with the Work Wellness and Disability Prevention Institute, and I'll be moderating the webinar today. This webinar is made possible through the support of the Community Gaming Grant Program through the BC Government, as well as donations and memberships to WWDPI. We thank our program partners, Canadian Council on Rehabilitation and Work, Education Advisory Committee, and speakers who contribute to this webinar series. While we're waiting for others to join us, I'll go over a few technical points for the webinar. You should be able to hear the presentation through your computer speakers or through the conference call line if you dialed in. Please use the question box to submit any issues you may be experiencing and to ask any questions related to the presentation. We will collect questions submitted throughout the presentation and follow it with a Q&A based on the questions submitted. Any questions not answered in the allotted time will be answered and distributed after the event. The presentation will be recorded and posted for free on our website along with the slides. You will be emailed the direct links for all of these items when they're available. We're honored to have Dr. Arla as our presenter in today's webinar. Dr. Arla is a professor in industrial organizational psychology at St. Mary's University, specializing in occupational health psychology. She's also the director of the CN Centre for Occupational Health and Safety. She's a fellow of the Canadian Psychological Association, and she was a Canada Research Chair for 10 years. Her research focuses on developing and implementing effective organizational and individual initiatives that address leadership, healthy workplaces, workplace respect and civility, employee well-being and work life. Arla, welcome. Thank you so much for presenting today's webinar. We're looking forward to learning from you, so I will hand it to you right now.
Thank you very much, Yusra. And thank you very much for the WWDPI for hosting these and for inviting me to talk today. This had came across, Mark and I had talked about several things for several years about these issues and really wanted to look at how do we integrate the mental health and mental well-being in workplaces that are already doing well in sort of their safety work. So for organizations that really think of themselves as a healthy place to work, as a safe place to work, what are they doing in terms of mental health? And what we, in terms of our very, I think, very a lot of goals today that we can deal with. Very going to be a good hour that we're going to have today together, and looking at what we can learn about the link among mental health, physical health, and safety, and how do they all fit in together. We also are going to talk about some specific practices and sort of the philosophy behind those practices of how do we support individual workers, how do we create these inclusive and effective work groups, and how do we develop leaders so that they're able to support mental health of not only their employees and their direct reports, but also themselves in this safety conscious workplace. Hopefully, given all this information, you'll then be able to evaluate your own workplace and create some basic guidelines of how you go about integrating mental health into your own strategy. Now, historically, we've done very well, organizations have done well at identifying the safety aspect. I think Nova Scotia and the Workers' Compensation Board of Nova Scotia has done a very good job. This is one of their recent ads looking at workplace injuries. So really encouraging individuals to be accountable for their own safety and to understand what the impacts are on them. When it comes to the mental health platform, though, it's not as clear. And so we know what injuries look like. We can see those, but do we know what mental health looks like? And if we think about this, and we look at, here are some people, very smiley, happy people, we can say, on the surface, this is great. Of course, these are very, very happy, mentally healthy people. Now, for those of you who like watching, the Hollywood news and in Entertainment Canada, you'll probably know that all of these individuals have come out publicly as suffering from some type of mental ill health, anxiety, illness, some cursory ones and some longer term issues. So on the face of it, no pun intended, we can't always tell what mental health does look like. And in fact, in Canada, if we look at some stats, just in basic general stress, we have over 80% of Canadians reporting that they experience excessive stress in their day-to-day lives. In terms of disability, mental health, actual illness, and issues are the #1 cause of disability in Canada. We also have data showing that about a fifth of the Canadian working population at any time may experience mental health issues, which can impact their work. And we know that another stats, 500,000 Canadians in any given week are unable to work due to mental illness. So what is it that we can do? Because the good point is we also know that improved management of mental health in the workplace to combat stress and identify some of these other issues can significantly improve productivity and well-being of employees. So with that knowledge, we kind of say, okay, that's good. We can be proactive and there's stuff that we can do. But if we go back to our thinking about what is mental health. So if we're taking some of these stats and if we have, about the approximately 20% experiencing, some mental health issues. And as you see by our little icons here, it could be we think of depression as one, but it also can be severe anxiety and social anxiety. It can be emotional trauma and an issue that they may be dealing with. And then we have the general, on your left, the generally healthy, happy population. If we throw in the stress, we've got other individuals in there, and some of those might actually transfer into some other depression as well. And we like to think this is sort of the reality. We've got the group of healthy employees who are able to be resilient and get through, and then we have a group of individuals who may be suffering some issues at some point. But this dichotomous view of mental health is not helpful. And even some of the actions that organizations have taken, and I think of Bell's campaign of Let's Talk, which makes great strides at identifying, it really puts the onus on individuals of having to self-identify of being in this group on the right. And that's not the way reality is. And in fact, if you look at your life, it's more of kind of a process here. You have some better times and healthier times, and you might have some harder times and more difficult times. They might be little aspects of it, or it might be big. Now, hopefully, we'd like to see most of our employees and most of our friends and family sort of above the line, but we know that there's going to be that variability. And as you can kind of see on the left-hand side, I always refer to that as the teen years, where you're kind of like, you're happy, you're sad, you're happy, you're sad. And this is the way that we can progress from that. So if we look at it in this way, if we take mental health as kind of a longitudinal life view of it, and then we can always look at, we like to say with our Empower group, that all of us at some point in our life, we're all dealing with stuff. And with that, then, we can actually make progress. So if we take that view that everybody is dealing with something at some point in their life, and again, it might be big, it might be little, then we can normalize mental health and bring it into the organization of this is what we need, this is how we need to address it. So again, if we look historically at what we consider to be safe and healthy workplaces, a lot of the effort and a lot of the work that we've done has really focused on the physical health and safety of it. So looking at safe practices and make sure people wear their hard hats to work, make sure that there's the asbestos is removed from the wall, and ensuring that safe aspect of it, which is very important. There's also been some emphasis on employee behaviors and lifestyles. So making sure that we get our flu shots, we drink in moderation, eat lots of healthy vegetables and fruits, don't smoke, and get cholesterol checked and blood pressure checked, et cetera, et cetera. All of those things lead to healthier workers and will help having a healthy organization. But the one thing that we sometimes forget about is this kind of vague psychosocial environment. And what we're mean by that is it's the psychological aspects, it's the mental health aspects, the well-being aspects, and also the social aspect. So how are we interacting with each other? So the more emphasis that we put on this, it creates a more holistic, better picture of what a safe and healthy workplace is. And in essence, these are all interrelated, and they're all related to each other, and we'll show you how, and I'll show you how in just a moment. So the connection between mental health and safety, we know that individuals who have more positive mental health or fewer illnesses and issues, they are also able to behave in more safe ways. It doesn't mean that they are always, but there's a small relationship between those. And we also know that being safe creates stronger mental health. And if you can imagine being in a very unsafe workplace, that would stress most people out. If you did not know whether you were going to come home safe every day, that would create a lot of mental strain for individuals. And then from our perspective, the way we look at it as well is there's this whole group of work aspects that impact both of these things. So by focusing on some of those aspects, we can actually look at how we are creating a stronger work environment and making health and safety our priorities. So another way of looking at this is if you look at the literature, we know that mood, attention, and fatigue all impact on safety. So if I'm in a bad mood, I won't be paying as much attention, and I'm also can increase my incidence of safety. If I'm not paying attention, or if I'm tired, the same ways I can have or more safety incidents and accidents. We also know that mental health is associated with mood, and improved mental health is associated with higher attention and with less fatigue. So if you improve mental health, you can theoretically improve safety outcomes in the organization. And the other aspect, of course, then are these work factors. So we know that there's certain work factors that impact directly on mental health. We also know this whole area of the culture of the organization. What does the organization and the leaders value? What do they do? That can impact both on safety and mental health at the same time. And I think a good example of the link between these constructs is some training that was done by some of my colleagues and some of our PhD students at St. Mary's, Dylan Smeebert and his colleagues. And they are safety people, and they were looking at heightened attention training for safety. And when they're talking about this, they also focus on the 3E questions on the environment and employee and expectations. And one of the questions about the employees, what is different about me or my team? That brings in that psychological aspect. So if there's something happening to the employee, if the employee is stressed, if they're experiencing stress outside of work, those can all be issues that would trigger individuals going through this training to say, this may be a safety issue that we should take care of. And just following along on that, I think this is one of the best ways to link this physical and psychological health and safety. And this is from the brilliant Gary Larson, and looking at the bomb squad here, and as I said, sophisticated firing system, hair trigger mechanisms, and Bob's wife just left him last night, so you know his mind's not into this. So right there, we look at the direct link between stress, and even stress outside of work, and our connection to physical health and that attention. So given all of those aspects there, what can we do? How are we able to move forward in looking at this? So the first basic thing, and I'm sure I'm preaching to the choir here, is that we need to recognize the importance of mental health for the physical safety at work. They are inextricably linked. So if we go back to our model that we have and really focus on what is it that we can do directly as organizations, as leaders, even as coworkers, what can we work on? We can look at culture and we can look at work factors and changing those. And we can even do that in more detail by focusing on 4 different areas. And this is the Igloo Model. And that's really focusing on the I, the individual, the G, group, the leader level, and the overall organization. And we use this as part of our training for organizations and for leaders and individuals. So as part of our Empower Healthy Workplace partnership, we look at how do we go about foster psychological health in a safety conscious workplace. So that's sort of the overall goal of that. And to do that, we think about go to the individual. How can we support individuals? So if we're talking about mental health, how can we improve their mental health and help them develop resilience and skills to initiate healthy behaviors so that they stay healthy? But we also look more. It's more than an individual problem. It's a group issue, because it's how we talk about mental health. It's how we treat each other at work. So the question becomes, how can we strengthen groups to support the psychological health in order to reduce stigma and promote health and safety? And then ultimately, we always look at the leader. So how do we develop leaders to help them support workers, strengthen these groups, and create this overall healthy workplace? Because they lead to all of the other aspects of that without the leaders. So we see them as playing an absolute key role in this work. The other thing that we want to look at is, and where we're starting, is looking at the difference between primary, secondary, and tertiary interventions. And historically, of course, with anything, and even with safety, it's kind of been looking at treating the symptoms. So what do we do after there's been an accident? How do we get help? How do we help the person? If there's been a heart attack at work, how do we go in and save the person? How do we make sure that we have the resources necessary? From a mental and physical health perspective, we really need to shift our focus from just a tertiary treating the symptoms to a more primary prevention. So how are we able to change the workplace? How are we able to increase resources to employees and reduce unnecessary demands on them? And that is one of the key driving forces, it should be, for all organizational programs in this area. Now, so that's a great start, but it's not enough, because no matter what you do in an organization, no matter how perfect you are, there's always going to be demands and there's always going to be stuff happening. So we also need secondary interventions in there, and that's really looking at how are we developing the resilience in our employees? How do we help them cope with what's happening at work or in their other aspects of their lives? And so that when stuff does come across and they're dealing with that stuff, they're in a bit better position to handle it. And then we go to the treat symptoms. So we should never totally ditch the treat the symptoms, but we need to have that in there to show as that tertiary place, that occasionally, even after we look at primary and secondary, things may happen and we need to have supports for our employees, and including leaders and groups, to help them deal with all of those. So what I wanted to do now then is kind of take some time to go through just give a couple of examples of what an individual, group, and leader interventions would look like. So if we start off with these initial individual initiatives, and again, through some of our work through Empower, we have various programs looking at helping the individual. So there's coaching programs such as ABLE and Action that help individuals, it's sort of as that secondary level, develop coping skills, develop resilience, so that when stuff happens to them, they're in a better place to deal with it. So we talk some on health aspects, and this is just a nice diagrammatic from Australia that I like to use and kind of show. When we're looking at health, we taking again this overall holistic picture of it, and people typically know that you need good sleep, have a healthy diet, and get plenty of exercise in order to be healthy. So we're fairly clear on those things. We don't always do them, mind you, but we know that we should be doing that. When it comes to stress, however, this is, we sometimes are left in, well, what do we do with this? How do we reduce the negative demands and stressors in our life? Or how do we help cope with those things? Now, the good news is, if you are doing these other three things, getting good sleep, eating well, and being active, that in itself can have a positive impact on your stress level. There's that may not be enough, though, and there's other things that we can look at to reduce the ill effects of stress. So when we're talking about supporting mental health and safety at an individual level, we can offer programs looking at values. So we talk a lot about what individual values are, how they're aligned with the organization, and how they're aligned with your own behaviors. So if your values are aligned with your behaviors, even if things happen, you at least know you are moving in a positive direction. So it may not always work out, there may be problems, but you're still moving forward. If you're looking at it in terms of resilience, so how do you deal with setbacks? So if something happens, what's your sort of initial reaction or gut reaction to that? And what is it that you can do on that in order to be more prepared when things happen, and to be able to be proactive in that? Now, this is a huge area, and I can talk a little bit more if there's some questions. I wanted to leave some time for questions on about the individual aspect of it, in terms of what we can do. We think in organizations like we have employee assistance programs or employee and family assistance programs. Those again are individual. They're more as a tertiary. We use them as tertiary. So when something has gone bad, then we're like, oh my God, how do I deal with it? And we go back in there. What we try to emphasize is what organizations can kind of push that ahead in order to support up front. So how can we make this, and it's not just somebody who's in need now, but give these skills to everybody with the assumption that they're going to deal with that. And again, if you have questions, I can talk more about specific programs and where to go on those. From a group perspective, this is kind of interesting because, again, a lot of times when we're talking about mental health, the go-to that most organizations or leaders, their first instinct is to say, well, let's just change individuals. So we deal with their mental health issues, and that's the real issue. And I guess maybe not a surprise to everybody, but the group initiatives can have as big an impact on well-being as these individual initiatives and interventions. So really looking at how individuals interact. The thermostat example here, as you see this little icon here, is really about perspective taking and developing empathy. So a lot that we see in terms of conflict at work, about not being supportive of people with maybe some mental health issues, or just generally unsupportive, is giving them some skills to be able to take the perspective of others. So my thermostat example is the thermostat wars. And if you live in Canada and dealing with the cold at any point, I'm sure you've been in thermostat wars, either at work or at home. And this is where, you are freezing and you go and turn up the thermostat, and then sometime later somebody comes by and they turn it down because they are sweating, and then you go turn it up again, and it goes back and forth. And the question I always ask people is, in these times of conflict, is who is right? And if we're being 100% honest, and a little bit of our brain is saying, well, of course I'm right. If I'm feeling hot, then that is my reality. Or if I'm feeling cold, that's my reality. But then the other part of our brain sets in and says, well, of course, we know that we're both right, because it's both our realities. So this is whatever issue we're talking about, whether it's temperature, whether it's how to get a project done, whether it's our views on work and life. When we have these differences and potential conflicts and interactions, that how it is handled as a group impacts our own well-being and our functioning together. And if we look at these groups, not as sort of an autocratic dictatorship where you have your leader saying that, this is the way it is, but that we all more have an inclusive, we have a say in the process, then that is another key aspect of how the group can be that supportive mechanism for the individual. And with that, the other analogy with the voting analogy is that a well-functioning group is like that, is a democracy like that. So it doesn't mean that we get our way every time. It means we get to have that input. We get to vote on the issues, but we may not always come out on top. But we do are effective as a group and moving forward. The other icon there is the tipping point, and that's sort of the iconic aspect of incivility, and how incivility can increase and go into higher or more negative aspects of bullying, aggression, verbal aggression, and even physical aggression. So again, that is when you have perceived incivility. If you think somebody's being rude to you, and then you reciprocate back to them. And of course, you may or may not be 100% right for that, but that is your reality and your perception for that. And getting people to understand that everybody has a different view on things, and rarely do you find individuals getting up in the morning and saying, how can I be a complete and utter jerk at work today? If we go in the assumption that people are trying to get along and work together, then this is key in developing this strong group and for healthy well-being and mental health. The next area, then, as a group, it's also how we talk about mental health and how we conceptualize it that has huge impact on how we are really valuing the individuals and treating individuals with mental health issues. So these series of pictures are really interesting because it shows, so what if we talked about mental or physical health the same way that we talk about mental health? And so, for example, yes, you see, you just need to change your frame of mind, then you'll feel better. Another one, and somebody's sick, have you tried, just not having the flu? And again, it's like you're not even trying. And finally, I get that you have food poisoning and all, but you just have to make an effort. So these are all things that we say about mental health. So have you tried not being depressed? I get that you have social anxiety, but you got to at least make an effort by going through, whoops, sorry about that, by, by highlighting that, how we talk about mental health in the workplace or anytime really emphasizes how we, think about our colleagues. And if we can take away that language and that stigma, then we can create a much more inclusive, much more supportive work group for them. Okay, so with that, and again, if I'm talking about what we do, what we can do with this, some of the programs that we look at are things like CREW, which is civility, respect, and engagement in the workplace, or work, which is work and organizational respect and civility. And that really brings in the group to say, okay, what is acceptable behavior in your group? What is of value to you? How do we support each other through good times and bad times? And what are our acceptable responses to mental and physical health issues as well? And we give them some skills in terms of communication skills, conflict management skills, that perspective taking, all of the things we talked about. And we let them set the ground rules in terms of how do they work together and how are they going to support each other. Now, with these, the big thing, as we said, is really about how the leader is involved in all of these aspects. So there's several different leader initiatives that you can go and instigate here. You looking at LEAD, which is leader effectiveness and accountability and development, leading healthy workplaces, or MHAT, which is mental health awareness training. So all these training programs look at how do you help in the MHAT one, how do you help support leaders identify when maybe things aren't okay with their employees, and what steps do they take in order to ensure that that individual feels supported and gets help. The Leading Healthy Workplaces really talks about giving leaders the skill to deal one-on-one and as a group with their subordinates, direct reports. And as you can see from some of the aspects here, about the support, how are they demonstrating their support and care? How are they communicating effectively, providing feedback, involving those employees, and promoting a healthy workplace? So by giving the leaders skills to able to identify mental health issues, to be able to deal more effectively, to support individuals, and this isn't just individuals with mental health issues, it's for all employees in there, and the leadership development, then that can create that culture of support. It can help others in the group become strong and vocal supporters of their colleagues, and it gives them the skills and how they develop it. And it also provides, again, that primary, secondary, and tertiary levels of intervention for their employees. Now, the interesting thing about here, I would say 90% of all leader initiatives are always focused on the employees. So what can we do for the employees? We've tried shifting this and saying, okay, this is great, but who's supporting the leaders? So when we're doing the leadership training, what are we doing in order to help the leaders to make sure that when they're dealing with stuff, that they have somebody to turn to, that they have a process that can support them, that they have all the resources that their direct reports have. So we've kind of, in a lot of cases, kind of unintentionally kind of push leaders to the side and say, no, you got to deal with yourself. We're more interested in everybody who's working for you. So by remembering that we are better leaders when we are physically and psychologically healthy, then that, I think, gives all the precedence and making sure that we have programs and initiatives aimed at helping leaders deal with life and work stuff. Now, saying that, the data I have here is really looking at employees. So I just wanted to give, this is some stuff done through LEAD, and this is with Nicola Hartling, one of my PhD students, and she was asking in terms of to what extent did the leaders see it as their role to support? And this is for both physical and mental health issues. So we see that, great majority of them, if we add those categories up, like 92% of them are saying that was a yes and a definitely yes, is that, yeah, that is our role. And slightly less, but still high there is 80% in that they're capable of supporting. So there's some efficacy in these groups saying that, yeah, I think we can. I'd still, of course, like to see that extra 20% saying, yeah, I can. I'm able to handle this. So putting training toward those ends is money well spent. And then we were asked the same leaders. So have employees disclosed what they're struggling with? So we targeted three things. One of them was a caregiving. So workers either is dealing with caregiving issues with their children or with relatives. And they said that 48% had disclosed that they were dealing with some stressful situations in terms of caregiving. 36 disclosed that they were dealing with chronic physical health conditions, and then 32% said that their employees had disclosed in terms of chronic mental health conditions. Now, what's interesting is this number. So we're actually interesting that about the same amount are saying yes, they've had employees disclose about physical health conditions as well as mental health conditions. But then when it comes down to requesting accommodations if we put those parallel, so we see that for the physical health conditions, everybody who's disclosed or all of them that have disclosed are asking for accommodation. Yet, even though 32% disclosing that they're hearing about chronic mental health conditions, they're only hearing accommodation requests for about half of that. So this discrepancy here is really suggesting that there is still that stigma around the mental health. And as leaders, it's like, what do we do with that? So what do we do with that information, and how do we help them employees feel comfortable coming forward? And this was some of the work with the Leading Healthy Workplaces, is being able to create a culture and forum where they feel comfortable in coming forward to the leaders and discussing those issues or asking for accommodation, or the organization having a system in place that it is flexible enough to accommodate. And I think the one thing that we do see is that employees don't want to necessarily be a poster child for any physical or mental health issues. They don't want to have to come forward and say, okay, I'm suffering from depression, or I'm suffering from a chronic disease, and I'm going to be open about this in my workplace and get accommodation that way. A lot of them are wanting it as a much more subtle or much more quiet process. So this is where having this supportive culture can be very effective. So to show that that they can help individuals without it being a burdensome effort on the individual to come forward. So what do we do as an overall organization? So what I did here is, this was in a recent book that came out, is that I took an old model of culture, of organizational culture, that looked at basic assumptions, values, and artifacts, and looked how we could put it in a healthy and safe work culture and how that impacted on employee well-being and organizational functioning. And what we see here, so artifacts are all of those things in an organization that we can see or read and that are visible to us. So they may be our mission statement, they may be the healthy workplace initiatives, it may be our EAP policies or programs, it might be training, it might be benefit packages. It could be the physical work environment, how the offices are set up. All of those things we make assumptions about the organization based on that. But what drives those artifacts are these underlying values. So we might have all of these initiatives. We might have some wonderful training packages. We might have a great EAP program because we value worker health and safety. We value their ideas and input. We want them to be healthy and safe. We also might have them, if I'm being cynical, we might have them because we want to make sure that we just recruit the best people. We might want them to make sure that we don't have any charges against discrimination on that. We might have safety policies in there because we don't want to pay we value money too much and we just don't want to pay if somebody gets hurt or killed on the job. So the artifacts may look the same, but the values can be very different. They can be the positive way in terms of the valuing, we actually value our employees, or it may be there for other reasons. The basic assumptions are the underlying assumptions we make about life, about humans, that we don't ever question. So people are inherently good, workers are inherently productive if left on their own. Respect and compassion is integral to relationships. We rarely question these things, but they drive our values. So in terms of using this model, how do we use this model to move forward, is as organizations, and I see this is, if you're familiar with the Canadian standard, this is where I see a lot of organizations struggle with the standard on psychological health and trying to implement, because they're looking at artifacts rather than values. They're looking for a new policy. They're looking for a new program. So if I offer, apples in the cafeteria, does that make me healthy? If I have an open door policy, are we good to go? I don't need to do anything else because people think they can come in and talk to me. So they're looking for these specific tangible things without identifying their values. Okay, I'm going to just, looking at the time here, I want to make sure we have time for questions afterwards. So overall at an organizational level, even though we have a lot of demands on us and workloads and role conflict, our job as leaders and our job in organizations is that we try to minimize all this bad stuff. So the you hear about toxic bosses, I just call them unskilled because they haven't had the training to be better. So how do we minimize those, have good leaders, minimize the overload so it's manageable workload, and how do we leverage all these positive things about giving work as being meaningful for individuals, having that positive social support and leadership. So as some take homes here in terms of what can you actually do, I wanted to use my BUILDS acronym to help you think about building a mental health and safety strategy. And that the BUILD stands in for buy-in, understand, the initiatives or implementation, learning, and developing sustainability of those. So if you are interested in developing such a strategy, the first question that you have is the buy-in. So do your key stakeholders actually believe in the values of mental health and safety strategy? Do they believe the evidence that's out there that shows that mental health is an important workplace concern and can impact effectiveness and well-being and at an individual and organizational level? So if your answer is no, this is kind of your action place. So you can identify the data and evidence out there. I would say go to universities find individuals doing this, people like me are always happy to share what we know with organizations and the data. And then are you able to develop that awareness? Are you able to develop documents and showing this and having information sessions for your stakeholders? I will have the caveat here is if your CEO or owner and all of that, if they have power, especially if you have an owner CEO where they're not going to get turfed, if they really don't buy into this and they don't really care and they don't really value mental health or safety in that, you are going to have a big struggle on your hand. This is not going to be easy. And, you know, some people have talked to me and I'm like, you know, at some point I'd even say, if they're not going to change and this is important to you, you know, go elsewhere. You know, pack up your bags and you can be of much use to another organization who actually realizes the power and there may be more responsibility to employees. Now, if you're in the happy category to say yes, they do buy this, then we get to go to step 2, and this is the understand. So a lot of organizations kind of stop there and say, but do you know what your current situation is? So in terms of what does mental health in your organization look like? What are the issues? What are your employees dealing with? And do you know where you want to be? So again, no, if you don't know any of these questions, then go back, collect, review your own data. So this could be human resource data that you may have. It may be some organizational survey data. What is important to your employees? And then and share data with stakeholders, and then move forward to step 3. Initiatives. So this aspect is, do you know what initiatives that you can implement, or do you know the effectiveness of your current initiatives? So if you're at the no stage here, then again, remember that Igloo we talked about, the individual supports that you can look at, strengthening the work groups, developing leaders, and of course the overall organization. So there's things that you can do at each level to bring that up. Ask your stakeholders what's important and to them, and connect with the values of the stakeholders and the overall organization. That is your best way to ensure that sustained buy-in and moving forward. So then once you have that in place, you can implement, and then we go to step 4. So this is the L, the learn of it. So have you assessed whether anything in your organization, whether these initiatives are actually helpful? And a lot of organizations, if you say no, you're not alone, because I'd say 90% don't do much, if any, in terms of program feedback, what works, or surveys, or more systematic assessments of whether these things actually worked. So are we able to improve mental health, improve safety using these initiatives? And then you can say, yes, if it was helpful, you actually do know, and it was helpful, move on. If not, so yes, you do know, but the things you're doing are not very helpful, you need to go back to step 2, kind of review where you're at and develop new objectives and initiatives. So the last part of this model is really looking at develop the sustainability. So do you have a plan to ensure that your mental health and safety strategy is sustainable? If no, and again, don't worry, you're probably up with like 95% of all organizations. Things that you can think about on this are looking at incorporating strategy values into your mission. So once mental health, safety, employee well-being become key words in an organization's mission statements, then you're always aligning, you're always making sure that your behaviors, the organizational behaviors, are aligned with that mission, vision and mission statement. Identify the stakeholders who can support the strategy. So who are there that are keen on these aspects and are able to see them through, again, as part of their job, as part of their mandate, as part of their passion and their values. And if you said yes to this, then great. Repeat your steps as necessary, as required, and move forward through that. So just to finalize, we've got a few more slides here in terms of what do we know? So mental health is necessary for physical health and vice versa. We can't simply focus on one and don't think it's going to impact on the other. Think about Igloo as a good acronym. We can help improve workers' physical and psychological health and safety, so their mental health, by not only supporting them directly, but strengthening those groups, helping our leaders, developing leaders that way, and doing it for the overall organization. Sorry, didn't put that in there, but it's there. Remember that the values that we have, those are not the artifacts, are key to success. So if your organization is constantly putting out wellness initiatives or constantly doing that, but they don't really have those underlying values of it, then you're always going to be struggling to try to make it successful. So that may require some challenging and really assessing in terms of what the values are. Remember to leverage the positive aspects of work. That work can be so functional to people. So let it help you in your process of creating healthy and safe strategies. And go back to the BUILD acronym. So the buy-in, the understand, your initiatives, your learn, and develop sustainability. And what I wanted to end off, this is one of my favorite cartoons, has nothing to do with mental health and psychological health, but it does have to do with climate. And this is Joel Pett, I think it was in the New Yorker, and saying, wait a second, what if this whole thing on climate is just a big hoax and we create a better world for nothing? So I saw this and I thought, wow, I saw the parallels to thinking about healthy workplaces and mental health in the workplace in our strategy. And so I took a few creative edits to this and really thought about, well, what if we were looking at this as workplace health in the same way? And that we actually have, so we have create healthier workers. We have them energized. We can preserve their respect. We can support their mental health. We have better jobs, livable workspaces, and renewed engagement. And on that note and lofty ideals, I will finish here and we can go into the question.
Thank you so much, Arla. So we do have a few questions, and I'll start with the first one. So can you please first clarify what are primary, secondary, and tertiary interventions? What do you mean by that?
Certainly. Okay, so I'm going to click back on here. We'll go back to those. So if we think about the same parallel in healthcare, sorry, it was far back. Didn't realize it was this far back.
That's okay.
There we go. Thank you. So the same type is, so sometimes a health analogy is the best way. So the primary is changing the environment, and it might even be people in the environment before the problem occurs. So if we think of a heart attack, so what we would probably say to the individuals is, okay, we're going to make sure we have manageable workloads. We're going to make sure in terms of our eating, we are not smoking and drinking excessively and eating fatty foods and that. So we're making sure we're reducing anything that could trigger the ill health. And in terms of mental health, then we'd look at, are there unnecessary demands? Are there those toxic, unskilled bosses? Do we have people feeling that they're on call 24/7 and they don't need to be? Those are things in the workplace that we can change before there even is a problem. So by reducing those, we create a better environment that way. The second part is develop resilience. So that is focusing on the individual to say, okay, sometimes at work, say if we're wanting to minimize stress, we try to have manageable workload. Sometimes it still happens. It's just like your heart attack. You can do all that you can, and you can still have a predisposition to have a heart attack, and you can have a heart attack. So if you are in, if the individual is in good physical and mental health when they have that heart attack, and they have the good support group, all of those protective factors, they are going to have a better success or better chance of success and coming through and having a healthy life afterwards. So how do we, in the workplace, how do we give everybody the skills and the abilities that when stuff happens to them, that it's still gonna impact them like that heart attack, but they're gonna bounce back faster from it. And then finally, the three is that when you have that heart attack, you still want that surgeon there. You want your cardiac surgeon there and is to able to go in and do the bypass and do the work that you need on that. But you don't want that as your first option. That's when everything else, sort of the other things we've gone through and that hasn't been sufficient, then we need that. And in the workplace, that's your like your EAP programs. That is, you know, even your supportive workplace policies. So when the person is dealing with stuff, it's happened, they've been resilient, we've tried to minimize it, it's still there. What can we do to support them? It's also, you can think of it as treating the wounded afterwards.
Thank you so much for your answer, Arla. And our next question is, so how can we change an environment that focuses on profit over people?
That's an excellent question.
Very tough one.
Yeah, and that's no pun intended, that's $1 million question, right? If you have that culture that does emphasize and I'll see if I can scroll more quickly to it because I do like the iceberg here. If that focuses their values are about making money rather than health and safety, it is, I've got to be honest with you, it is really tough to change, especially if you are one person and they are maybe multinational, or that you are in an organization that is, you know, as I say, I also find the owner CEO situation very challenging because they don't have to. They're the owner. They're not going to get fired. They're not going to fire themselves, and it's their values. So I have advised individuals on that. I'm like, you know, if you don't think you can change that individual, then you know you can go to different environments. If in a larger organization, I have seen success in those organizations. And typically it's not, they value money, they just don't think about the employees. It's not that they don't value them, it's just that they really are secondary. They don't really give it much thought. So those organizations you have more success in. And then you can bring them around. I sometimes resort to the return on investment, the ROI details. So, which kind of say, you know, there's some data to show that, you know, say every dollar that you spend on wellness initiatives in terms of mental health, physical health, you get a, you know, anywhere $3 to $6 return on investment. So if I need to go that direction to kind of say it really does come down to money, you know, you can save money by being supportive of your employees. You can by providing these initiatives. I will. I'm not that proud. I will resort to the money argument. I do try first to say, you know, don't you think that we should? This is our moral obligation to provide a safe and healthy workplace, because they are entrusting themselves with their lives and their health, and a lot of times that by doing that, it's making everybody stronger. It's not just a handful of individuals, it's making the whole workplace stronger. So when I have those types of organizations that are very monetary focused, again, I kind of, I test them out. I see if we can find some common grounds and those values, and then I work from there.
Makes sense. Thank you. Arla, our last question is, if there's one message for our audience to take away with them and use in their workplace, what would it be?
Oh, another great question. And I love it when they come down to one, because I always want to say, okay, I have like 10 that are good. I don't know, if I go down to...
or maybe again, the 3 best ones.
The 3 best ones? Okay, if we go back to again, if I'm just going to rely on the slide. So if you're moving forward and you're really trying to think of this, I do like the, again, well, these would be my 5. But if we really had to go thinking about what to take back with you, maybe I would say think about buy-in of the B part. If you can even get people to go, this is important, sometimes it will flow from there. And it doesn't always have to be top down. That makes your life easier. But if you can get people from, frontline workers are saying, this is important to us, we can also move that forward. If we think of this as more holistically, the supporting individuals, strengthening groups, developing leaders, I think that's a really good way because that makes it everybody's responsibility. And if I had to pick one, I'd probably go with the leaders. So if I can develop leaders, then they can influence everything else. How's that? Am I in my time?
Great. Thank you so much. Thank you so much, Arla, for teaching us about the Igloo model of supporting individual workers and strengthening work groups, as well as developing leaders to identify mental health and safety issues. And thank you for highlighting the importance of working collaboratively and that it is everybody's responsibility somehow to make the workplace safe and healthy, whether as individuals, co-workers, supervisors, managers, etc. So thank you so much, Arla, for this extremely valuable presentation.
You are very welcome. It's been my pleasure. And I hope it's been, if people do have questions for that, I'll put my last slide on and I believe you have it. Please feel free to contact me and I would love to hear from everybody.
Perfect. Thank you so much, Arla. And we'll have it up on our website by next week.